March 15, 2019. The Meridian Club, Manhattan's most exclusive steakhouse. At Table 7, two of America's most powerful CEOs are about to sign the largest pharmaceutical merger in history, $500 million. But the waiter refilling their water glasses isn't who he appears to be. And the four words he's about to whisper will bring down an empire built on lies. That's the wrong formula. By midnight, 3 people would be dead. By morning, $47 billion in market value would vanish. And the man they thought was serving their dinner was about to serve them justice. The man in the black vest and pressed white shirt looked like any other server at the Meridian Club. His name tag read Michael, and for 3 years he had been practically invisible to the wealthy elite who dined there nightly. They spoke freely around him, treating him like furniture, never suspecting that their waiter held a doctorate in biochemistry from Johns Hopkins University. They had no idea that every conversation about drug approvals, every whispered discussion about clinical trials, every casual mention of mortality rates was being absorbed by a man who understood the science better than most of their own researchers. Tonight, however, Michael wasn't just serving dinner. He was about to expose the most devastating pharmaceutical fraud in American history. Dr. Michael Chen had once been one of the most promising researchers in the country. Published in Nature magazine at 28, fast-tracked for tenure at Johns Hopkins, married to his college sweetheart Jennifer, with an 8-year-old daughter named Emma, who inherited her father's love of science. Michael's specialty was oncology drug development, specifically researching how certain compounds affected cellular regeneration in cancer patients. His work was groundbreaking, his future bright, his family secure. But life has a way of destroying the best-laid plans with ruthless efficiency. Emma's diagnosis came on a Tuesday morning in October 2016, acute lymphoblastic leukemia. The doctors spoke in measured tones about treatment protocols and survival rates, but Michael heard only the statistics. Traditional chemotherapy offered a 60% 5-year survival rate for children Emma's age. But there was hope in the form of an experimental drug called Oncozyme, manufactured by Apex Pharmaceuticals. Clinical trials showed remarkable results: 92% remission rates, minimal side effects. It was being called a miracle breakthrough in pediatric oncology. The insurance company, however, classified Oncozyme as experimental and refused coverage. The cost was staggering: $40,000 per monthly treatment cycle, with treatment lasting at least 18 months. Michael and Jennifer sold their house, emptied their retirement accounts, borrowed against his life insurance policy, and took out loans against his future earnings. $720,000. Everything they had ever worked for, gone in 18 months of hope. The treatment began with promise. Emma's energy returned. Her appetite improved. The tumor markers in her blood showed steady decline for the first 6 months. Michael felt vindicated in his decision to sacrifice everything for his daughter's life. But by month 8, something changed. Emma's condition plateaued, then began to worsen. Her oncologist, Dr. Patricia Wells, explained that some patients developed resistance to Oncozyme over time. They increased the dosage. The side effects intensified. Emma lost weight rapidly, her immune system compromised beyond what anyone had expected from the drug's published safety profile. Michael began to question whether the clinical trial data matched what he was witnessing in his daughter. By December 2017, Emma was sicker than when her treatment began. Dr. Wells recommended switching to a different protocol, a drug cocktail that included Apex Pharmaceuticals' newest compound, Celgard, designed specifically for patients who had developed Oncozyme resistance. The cost was even higher, $60,000 per month. Michael had already lost his house, his savings, and his career. The university had initially granted him extended leave, but after 18 months they quietly filled his position with someone younger and less expensive. Jennifer worked double shifts as a nurse, but it wasn't enough. They were financially destroyed, emotionally shattered, and Emma was dying. The Meridian Club job came through Jennifer's connection to Patricia Morrison, a wealthy philanthropist whose own daughter had battled cancer years earlier. Patricia understood the financial devastation that came with pediatric oncology, and quietly helped families in ways that preserved their dignity. She arranged for Michael to work as a server at the club where her husband was a member. The pay was decent, the tips exceptional, and most importantly, the health insurance would cover Emma's treatments under the standard protocols, not the experimental drugs that had already failed her. Michael swallowed his pride and learned to carry trays instead of conducting research. He traded his laboratory for a dining room, his microscope for wine glasses, his title of doctor for a name tag that simply read, Michael. For 2 years, Michael served Manhattan's elite while Emma underwent conventional chemotherapy. The standard drugs worked slowly but steadily. Her condition stabilized, then gradually improved. Michael began to wonder if the experimental treatments had actually made her worse rather than better. He started paying closer attention to conversations he overheard at the club. Pharmaceutical executives dined at the Meridian Club regularly, and they spoke freely about their work. Assuming their server couldn't possibly understand the complexities of drug development and regulatory approval, they were catastrophically wrong. Richard Blackstone was Apex Pharmaceutical's CEO, a man who had built his reputation on bringing breakthrough drugs to market faster than any other company in the industry. His net worth exceeded $2 billion, earned through what the media called his aggressive approach to pharmaceutical innovation. Across from him at table 7 sat Dr. Sarah Whitman, head of clinical research at Meridian Laboratories, the contract research organization that conducted most of Apex's clinical trials. Together, they were finalizing the acquisition deal that would make Apex the largest cancer drug manufacturer in the world, with exclusive rights to Meridian's entire research portfolio and their revolutionary new treatment protocols. Michael had served both executives dozens of times over the previous months. He had overheard fragments of their conversations about accelerated approval pathways, about managing adverse event reporting, about the financial pressures to bring drugs to market quickly in the competitive oncology space. But tonight was different. Dr. Whitman had brought her briefcase to dinner, something she never did. As Michael refilled their water glasses, he glimpsed the document she was reviewing with Blackstone. The header read, Oncozyme Post-Market Surveillance Analysis, Confidential Internal Review. The numbers on the page made his blood freeze. The real-world mortality data for Oncozyme showed outcomes that were not just different from the published clinical trial results, they were opposite. Instead of the 92% remission rate that had convinced Michael to bankrupt his family, the actual data showed that 68% of patients experienced disease progression within 12 months of starting treatment. More shocking still, 34% of patients died within 18 months, a mortality rate significantly higher than children who received no treatment at all. The drug wasn't just ineffective, it was actively harmful, and Emma had been taking it for 15 months. Michael's hands trembled as he continued serving other tables, but his mind was racing through the implications of what he had seen. Apex Pharmaceuticals had published fraudulent clinical trial data to gain FDA approval for a drug that killed children. They had charged desperate families enormous sums for a treatment that made their children sicker. They had destroyed thousands of families financially, while simultaneously destroying them emotionally by accelerating their children's deaths. And now they were about to expand this model globally through their acquisition of Meridian Laboratories. As the evening progressed, Michael listened more carefully to Blackstone and Whitman's conversation. They discussed the post-market surveillance data as a minor inconvenience, something that could be managed through selective reporting and statistical manipulation. They talked about Emma and children like her as acceptable losses in the pursuit of breakthrough drug development. Whitman mentioned that the FDA had begun asking questions about the discrepancies between trial data and real-world outcomes, but Apex's regulatory affairs team had successfully argued that the differences were due to patient selection bias in the post-market population. The agency had accepted this explanation and was moving forward with approving 2 additional Apex compounds using similar trial methodologies. The merger they were finalizing would create a vertically integrated pharmaceutical empire capable of controlling every aspect of cancer drug development, from basic research through clinical trials to manufacturing and distribution. More important, it would give them the resources to expand their model of fraudulent clinical trials and harmful drugs to every major cancer indication: pancreatic cancer, lung cancer, brain tumors, breast cancer. They planned to dominate every oncology market with drugs that generated enormous profits while providing no therapeutic benefit. Millions of patients would suffer the same fate as Emma, bankrupted financially and destroyed physically by treatments designed to enrich executives rather than save lives. Michael realized he had stumbled upon something far larger than a single fraudulent drug. This was systematic, organized healthcare fraud on a scale that dwarfed any previous pharmaceutical scandal. The Apex Meridian merger represented the industrialization of medical deception, the creation of a corporate machine designed to extract maximum profit from human suffering, and it was scheduled to be finalized tonight, with documents signed over dinner at Table 7. Before we continue deeper, let us know in the comments where you're watching from. We'd love to hear from you, and don't forget to hit that subscribe button so you never miss any of our upcoming videos. As Blackstone and Whitman prepared to sign the merger documents, Michael made a decision that would either save thousands of lives or cost him everything he had left. He approached their table with a fresh bottle of wine, his heart pounding so hard he was certain they could hear it. His voice was barely above a whisper when he spoke the 4 words that would change everything. "That's the wrong formula." Dr. Whitman looked up from the documents, her expression shifting from confusion to alarm as she realized what her waiter had just said. The chemical formulas in her briefcase weren't random numbers to him. He understood exactly what they meant, and he understood exactly what Apex Pharmaceuticals had done to his daughter and thousands of other children. Blackstone's reaction was immediate and vicious. He demanded to know who Michael was, how he had accessed confidential documents, and whether he understood the legal consequences of corporate espionage. Michael calmly explained that he was Dr. Michael Harrison, former research scientist at Johns Hopkins, and that his daughter had been enrolled in the Oncozyme clinical trial that had destroyed her health and his family's financial stability. He had not accessed any documents illegally. He had simply observed information that was carelessly displayed in a public restaurant, and he had every intention of reporting what he had witnessed to the appropriate authorities. The restaurant's atmosphere changed instantly. Blackstone made several urgent phone calls while Whitman quickly packed her briefcase. Other diners began to notice the commotion at Table 7. The maitre d' approached to inquire about the disturbance, but Blackstone waved him away, his voice rising as he threatened Michael with lawsuits for invasion of privacy, corporate espionage, and industrial sabotage. Michael remained calm, pointing out that he had been employed by the restaurant to serve their table, and anything he had observed in the course of his duties was not protected information. He suggested they continue their conversation in private if they preferred, but he would not be intimidated into silence about what he had learned. Within 20 minutes of Michael's confrontation, 3 additional executives from Apex Pharmaceuticals arrived at the restaurant. Their legal counsel, security director, and vice president of regulatory affairs surrounded Michael in the restaurant's private dining room, attempting to convince him that he had misunderstood what he had observed. They explained that clinical trial data was complex and that real-world outcomes always differed from controlled study results. They offered him money, a substantial sum that would cover Emma's remaining medical expenses and allow him to return to his research career. All he had to do was sign a non-disclosure agreement and forget what he had witnessed tonight. Michael's response was simple and devastating. He had already photographed the documents with his phone. He had recorded portions of their dinner conversation using the device's voice memo function. And he had emailed copies of everything to 3 different investigative journalists who specialized in pharmaceutical industry coverage. The evidence was no longer contained within the restaurant. Apex Pharmaceuticals could threaten him, bribe him, or sue him, but they could not suppress the information he had gathered. The truth about Oncozyme and their systematic fraud was already spreading beyond their control. The executives' demeanor changed from threatening to desperate. They offered Michael progressively larger sums of money, eventually reaching 7 figures, to retrieve and destroy the evidence he had collected. They promised to fund Emma's treatment with genuine therapeutic drugs, to restore his academic position, to provide his family with financial security for life. When bribery failed, they returned to threats, warning him about the dangers of opposing a corporation with unlimited resources and ruthless tactics. They mentioned other whistleblowers who had faced tragic accidents or sudden health problems after crossing pharmaceutical companies. They suggested that Emma's medical care could become much more difficult to obtain if her father developed a reputation as someone who interfered with legitimate business operations. Michael's response revealed the depth of his transformation from desperate father to implacable enemy. He explained that Emma was already dying because of their fraudulent drug, so their threats carried no weight. He had already lost everything that mattered to him financially and professionally, so their bribes were meaningless. And he had spent 3 years serving their elite clientele, listening to their casual discussions about human suffering as quarterly profit opportunities, watching them celebrate bonuses earned through the systematic deception of dying patients. He was no longer afraid of them, because he had nothing left to lose and everything to gain by exposing their crimes. The meeting ended with Apex Pharmaceutical's legal team promising swift and decisive legal action against Michael for corporate espionage, theft of trade secrets, and violation of privacy rights. They would destroy his reputation, bankrupt him through litigation costs, and ensure that he never worked in any capacity related to healthcare or research again. Michael responded that he looked forward to the discovery phase of any lawsuit they filed, as it would provide his attorneys with subpoena power to obtain internal Apex documents that would demonstrate the full scope of their fraudulent practices. He suggested they consult with their insurance carriers about their liability exposure before proceeding with legal threats. By midnight, Michael's evidence had reached Rebecca Martinez, an investigative journalist for the Washington Post who had spent 5 years tracking suspicious patterns in FDA drug approvals. Martinez had sources within the agency who had been quietly raising concerns about Apex Pharmaceutical's unusually successful clinical trial outcomes. Michael's documents provided the missing link between her sources' suspicions and concrete evidence of fraud. She immediately began verifying the authenticity of the clinical trial data he had provided and cross-referencing it with publicly available FDA submissions and medical literature. The first article, published 3 days later, sent shockwaves through the pharmaceutical industry and the stock market. Martinez had confirmed that Apex Pharmaceuticals had submitted falsified clinical trial data for Oncozyme, showing fabricated efficacy results and concealed safety problems. The real data demonstrated that the drug accelerated cancer progression in pediatric patients while generating no therapeutic benefit. More damaging still, internal company communications showed that Apex executives were aware of the drug's harmful effects, but had decided to pursue FDA approval anyway because the financial opportunity was too lucrative to abandon. Within a week of the initial publication, Apex Pharmaceutical's stock price collapsed by 78%. The FDA announced an immediate investigation into the company's clinical trial practices and suspended approval of all pending Apex drug applications. The Department of Justice opened a criminal investigation into healthcare fraud, with the potential for charges carrying decades of prison time for the executives involved. Congressional hearings were scheduled to examine the broader implications of pharmaceutical industry self-regulation and FDA oversight failures. But Apex Pharmaceuticals was not defenseless. They hired Whitmore Strategic Communications, the crisis management firm that had successfully managed tobacco industry lawsuits for 3 decades. Their strategy was comprehensive and ruthless: destroy Michael Harrison's credibility through any means necessary, while simultaneously minimizing the significance of the Oncozyme fraud as an isolated incident that did not reflect broader industry practices. They launched a coordinated campaign to portray Michael as a disgruntled former employee seeking revenge against a company that had nothing to do with his professional failures. The character assassination began with leaked stories about Michael's academic career, suggesting that he had been fired from Johns Hopkins for research misconduct rather than leaving voluntarily to care for his daughter. Anonymous sources claimed that his own research had involved data manipulation, and that his attacks on Apex were motivated by professional jealousy rather than genuine concern for patient safety. They highlighted his financial desperation and criminal background checks that supposedly revealed concerning behavior patterns, though no specific charges were ever mentioned. The campaign escalated to direct harassment of Michael and his family. Private investigators followed Emma to her medical appointments, photographing her and Jennifer in violation of medical privacy laws. Suspicious individuals appeared at their apartment building, asking neighbors questions about the family's activities and financial situation. Michael's phone received threatening calls at all hours, warning him to stop his cooperation with journalists and federal investigators. Their mail was tampered with, their internet service was repeatedly disrupted, and strangers approached Emma at school with inappropriate questions about her father's work. Most insidiously, Apex's legal team challenged Emma's medical treatment, arguing that her insurance coverage was fraudulently obtained because Michael had misrepresented his employment status and income when applying for benefits. They initiated administrative proceedings that threatened to terminate her health insurance retroactively, which would have left the family responsible for hundreds of thousands of dollars in medical bills and potentially unable to continue her cancer treatment. The message was clear: stop pursuing the Oncozyme investigation, or watch your daughter die from lack of medical care. Michael's response demonstrated why Apex Pharmaceuticals had catastrophically underestimated their opponent. He documented every harassment incident, recorded every threatening phone call, and photographed every suspicious individual who approached his family. He turned this evidence over to the FBI's investigation team, providing clear proof that Apex was engaging in witness intimidation and obstruction of justice. Their attempts to silence him had instead generated additional federal charges against the company and its executives. More importantly, Michael's case had attracted the attention of other Apex victims and their families. Parents whose children had died while receiving Oncozyme began contacting Martinez with their own stories of treatment failure and medical deterioration. Oncologists who had prescribed the drug started speaking publicly about their concerns regarding its unusual side effect profile and lack of therapeutic benefit. Former Apex employees came forward with internal documents showing that the company's fraudulent practices extended far beyond Oncozyme to dozens of other drugs across multiple therapeutic areas. The investigation expanded rapidly as the scope of Apex's criminal enterprise became clear. The company had systematically falsified clinical trial data for cancer drugs, arthritis treatments, diabetes medications, and cardiovascular therapies. They had bribed FDA officials to expedite drug approvals, paid doctors enormous consulting fees to prescribe their products regardless of patient need, and engaged in illegal price-fixing agreements with competitors to maximize profits from life-saving medications. The Oncozyme fraud was not an isolated incident, but rather one component of the most comprehensive healthcare fraud scheme in American history. Dr. Sarah Whitman became the investigation's most valuable witness when she agreed to cooperate with federal prosecutors in exchange for reduced charges. Her testimony revealed the mechanical nature of Apex's fraud operations, describing systematic protocols for manipulating clinical trial data, bribing regulatory officials, and eliminating witnesses who threatened to expose their crimes. She provided prosecutors with detailed financial records showing how Apex had generated over $12 billion in revenue from drugs they knew were ineffective or harmful to patients. The trial of Richard Blackstone and 8 other Apex executives became a national sensation, televised daily, and followed by millions of Americans who had been affected by the company's fraudulent drugs. Michael testified for 6 hours about his discovery of the Oncozyme fraud and the systematic harassment his family had endured for exposing the truth. His testimony was devastating because of his scientific credibility and his obvious moral authority as a father whose child had nearly been killed by the defendant's greed. Emma's testimony was the trial's most powerful moment. At 12 years old, she took the witness stand to describe how Oncozyme had made her sicker instead of better, how her parents had sacrificed everything they owned to pay for a treatment that was slowly killing her, and how she had almost died because the defendants had lied about their drug safety and effectiveness. Her quiet dignity and clear intelligence made an indelible impression on the jury, who saw in her the human cost of corporate fraud on an unimaginable scale. The verdicts were swift and decisive. Richard Blackstone was convicted on 47 counts of healthcare fraud, conspiracy, racketeering, and murder, receiving a sentence of life in prison without possibility of parole. The judge specifically noted that Blackstone had ordered the deaths of at least 3 potential witnesses during the investigation, making him responsible for both the systematic fraud that killed hundreds of children and the direct murder of adults who had threatened to expose his crimes. 7 other executives received sentences ranging from 25 to 40 years in federal prison. The financial penalties were equally devastating. Apex Pharmaceuticals was ordered to pay $14 billion in criminal fines and civil damages, the largest healthcare fraud settlement in American history. The company was permanently banned from manufacturing or distributing pharmaceutical products in the United States, and its assets were liquidated to compensate victims of their fraudulent drugs. More than 50,000 patients and family members received financial settlements recognizing the harm they had suffered from Apex's deliberate medical malpractice. The case also generated sweeping regulatory reforms designed to prevent similar frauds in the future. The FDA was granted expanded authority to conduct surprise inspections of clinical trials, with criminal penalties for researchers who falsified data or concealed adverse events. Pharmaceutical companies were required to publicly disclose all clinical trial results, including failed studies and negative outcomes that had previously been suppressed to protect commercial interests. Executive compensation was linked to long-term patient outcomes rather than short-term revenue growth, creating personal financial incentives for company leaders to prioritize drug safety over profit maximization. Michael Chen's transformation from desperate father to healthcare reform advocate became a model for other whistleblowers in the pharmaceutical industry. He established the Emma Chen Foundation, a nonprofit organization that provides legal and financial support to families whose children are harmed by fraudulent medical treatments. The foundation also lobbies for stronger patient protection laws and sponsors research into detecting and preventing clinical trial fraud. Michael returned to Johns Hopkins University as a professor of research ethics, teaching future scientists about their moral obligations to prioritize patient welfare over commercial success. Emma's recovery became a symbol of hope for families affected by pharmaceutical fraud. Her cancer went into complete remission 6 months after discontinuing Oncozyme and beginning legitimate treatment protocols. She excelled academically and developed her own interest in medical research, specifically focusing on pediatric oncology and patient advocacy. At 16, she published her first research paper on the psychological impact of fraudulent medical treatments on cancer patients and their families, work that has influenced how oncologists communicate with patients about experimental therapies. The broader implications of the Apex case extended far beyond a single company's criminal behavior. Congressional investigations revealed that pharmaceutical fraud was endemic throughout the industry, with dozens of companies engaging in similar practices of data manipulation, regulatory capture, and systematic deception of patients and doctors. The case prompted international cooperation on pharmaceutical oversight, with regulatory agencies in Europe, Asia, and Australia sharing information about suspicious clinical trial patterns and coordinating enforcement actions against fraudulent companies. The most significant long-term impact was the cultural transformation within the pharmaceutical industry itself. The severity of the Apex prosecutions sent a clear message that healthcare fraud would be treated as the violent crime it represents, with executives facing potential life sentences for knowingly marketing harmful drugs. This deterrent effect led to voluntary compliance improvements across the industry, with companies investing heavily in data integrity systems and ethical training programs to avoid criminal liability. Medical schools began requiring courses in research ethics and pharmaceutical industry oversight, ensuring that future doctors and researchers understood their professional obligations to identify and report potential fraud. Patient advocacy organizations gained political influence and regulatory authority, with mandatory representation on FDA advisory committees and pharmaceutical company oversight boards. The power dynamic between profit-seeking corporations and vulnerable patients began to shift toward greater protection for those who could not protect themselves. The personal cost of Michael's courage cannot be understated. His confrontation with Apex Pharmaceuticals destroyed his financial security, endangered his family's safety, and exposed them to years of legal harassment and death threats. He sacrificed his academic career, his privacy, and his peace of mind to protect children he would never meet from drugs that would have killed them. His decision to whisper 4 words to 2 strangers at a restaurant dinner table required the kind of moral courage that few people possess, and fewer still are willing to exercise when faced with overwhelming opposition. Yet Michael's sacrifice generated benefits that extended far beyond his own family's situation. His actions directly prevented thousands of deaths from oncozyme and related fraudulent drugs, saved billions of dollars in wasteful healthcare spending, and created regulatory protections that continue to benefit patients worldwide. The pharmaceutical industry became more honest, more transparent, and more focused on genuine therapeutic innovation rather than fraudulent profit maximization. Medical research became more rigorous, clinical trials became more reliable, and patient trust in the healthcare system was partially restored through visible accountability for corporate misconduct. The story of how a single father's love for his daughter brought down a pharmaceutical empire demonstrates the power of individual moral courage when confronted with systematic institutional corruption. Michael Chen possessed no special resources, no political connections, no media platform, and no legal authority. He had only his scientific knowledge, his parental devotion, and his unwillingness to remain silent while children died from deliberately harmful treatments. These simple human qualities proved more powerful than corporate wealth, political influence, and legal intimidation when directed toward protecting vulnerable people from systematic abuse. The 4 words that destroyed Apex Pharmaceuticals, "That's the wrong formula," represented more than a factual correction about clinical trial data. They were a moral declaration that human life has value beyond its commercial potential, that parents will sacrifice everything to protect their children, and that truth ultimately prevails over deception when ordinary people find the courage to speak it. Michael's whisper became a roar that echoed through boardrooms, regulatory agencies, and congressional hearing rooms, fundamentally changing how the pharmaceutical industry operates and how society protects patients from corporate predators. The legacy of Michael Chen's courage continues to inspire healthcare workers, researchers, and patient advocates who face similar moral challenges in their professional lives. His example demonstrates that expertise carries with it the obligation to protect those who lack the knowledge to protect themselves, that economic desperation does not excuse moral compromise, and that the most powerful weapon against institutional corruption is often the simple willingness of one person to tell the truth, regardless of personal consequences. In a world where corporate power seems insurmountable and individual voices appear insignificant, Michael's story proves that ordinary people can achieve extraordinary change when they refuse to accept injustice as inevitable. The man who had once served Manhattan's elite their dinner had ultimately served them something far more substantial: justice for the children they had poisoned in pursuit of profit. His transformation from invisible waiter to unstoppable advocate illustrates how circumstances can reveal character and how moral courage can emerge from the most unexpected places. The pharmaceutical industry learned that their most dangerous enemy was not government regulators or corporate competitors, but rather a single father who loved his daughter more than he feared their power. And in the end, that love proved stronger than their greed, more persistent than their corruption, and more powerful than their money.